Howdy everybody, and welcome back to the storage room at Health Force Kentucky. Bringing some new equipment to you and making sure that everybody knows what inventory we have for you and your students. This is a needle decompression, finger thoracostomy, and chest tube trainer. And it has the ability to lay down or stand up. It trains the placement of needle decompression. It also has the ability to allow students to practice chest tube insertion along with their incision, landmarks. They will also feel the pop as it goes through, whether they're using blunt dissection or whatever method you're teaching them. This particular device allows us to inflate the needle decompression ports, and once it goes high enough, it will have a sound come out of this little white port, meaning that it is pumped up and holding back or holding pressure against it, so the student will actually feel that release of pressure when they get into it. We can also, but don't very often, add bloody drainage into it for a hemothorax. Inside, you're able to feel lung tissue so that you can make sure that you're sweeping and not having lung adhesion and also haven't cut into the lung. And we also have ultrasoundable inserts that you can teach thoracostomy or lung assessment using an ultrasound device. So one of the other nice features about this product that came with it is this new augmented reality mat. This can be used with or separately from the device itself. So by raising the device and scanning the table, what is on the table, you are able to see a semblance of the trainer that is to the left. And by pulling up the animations, you can use tension pneumothorax. By looking up inside, you can see that the left lung is collapsed. It also mimics breathing and is able to show you what's going on with it. One of the other nice parts about this augmented reality is you get to determine where you are showing and what the students are seeing. So this is the pneumothorax. It does go farther. It will bring in a needle and a chest tube and show re-expansion of the lung. I'm going to switch over to the hemothorax, and now you can see the lower ridge down here. There's my finger. The lower ridge down here shows where the hemothorax or where the blood level is, and we can come around and look at what is going on inside, and it will help the students understand why for a hemothorax we use a lower approach, and for a pneumothorax we use an upper approach in the direction that the tip is being angled for the procedure that we are doing. So this augmented reality device is super fancy, and we're really happy to be able to bring this to you. If you are within our 16 county region and interested in leasing or having a loan of any of the equipment, please contact healthforcekentucky.org and fill out an event, equipment, or tour request, and one of our staff members will be back with you as soon as we can.